So I think it's really important for people who have cancer and are in the middle of their treatments, they should continue those treatments. And there are many safe ways to do that. You need to work with your physicians. We may communicate differently with you and try and find ways to make your care more streamlined. So minimize the number of times you might have to come in, check in with you by video visit instead of making you come in each time. But if you need to come in for chemotherapy, it is safe to do so. What you have to do, though, is be careful. So stay home and shelter in place. Don't go to the grocery store yourself. Get others to do that for you, or get food delivered. So really minimize your exposure, especially when you know your blood counts are low. It's really important to try and keep yourself safe if you're getting chemotherapy.
Patients with cancer should be on heightened alert. The emerging data certainly suggests that patients with cancer not only have a higher death rate from coronavirus, but also are sicker when they do get it. Even in a city like New York, where public transportation is necessary because not everybody has access to their own private vehicle, still maintaining social distancing, wearing masks. If you see someone who might look ill or is sick and coughing, move to another car. I think the most important thing for any patient with cancer to know is that if they're in any way feeling unwell, they must seek medical attention. The majority of hospitals, particularly now, even in New York, and speaking from my hospital in particular, we now have less COVID patients in the hospital than we do non-COVID patients. And so we've done what I think is a really good job of making sure that we can able to separate those patients who have COVID from those patients who do not have COVID. So for example, upon entry into the emergency room, if we're concerned, we test you immediately, and we wouldn't send you to the non-COVID cancer floor until we knew that you had a negative test. I primarily treat patients with lung cancer, and I've had several patients who are on maintenance therapy, whose cancer was stable and had been stable for many months, who elected, after having a conversation with me, to put their treatment on pause for several weeks, which essentially would mean they would miss about 2 to 3 treatments, and now are starting to come back in.
There are many different ways in which we could keep people out of the operating rooms early on, and that's something that a lot of us do standardly. And if you have something that, there's active surveillance protocols for some conditions, and for prostate cancers, for some in situ cancers, and it's really fine to wait. And even with radiation therapy, so if you are in the part of your treatment where you need radiation therapy, waiting an extra 4 weeks is not going to make much of a difference, really. I think the word cancer, when someone hears that word, they think, oh my gosh, I'm going to die, and I might die in the next few weeks or the next couple of months if I don't get it treated. But that is rarely the case. Now, with the exception of a leukemia, that is not the case. The stage 4 disease, the goal of care is to try and control the disease. For the most part, we're not able to, in the long run, eradicate disease, but it's about control. When you go under general anesthesia and you have the virus, that virus can really spray. It sprays in the air and can affect everyone around you. So one of the things that was important to do is try and get some testing in place.
We're testing everyone prior to surgery so that we know what their COVID status is. And we're still using, all of the appropriate PPE that we would use for normal surgeries. And then for patients who have COVID, we're using the additional PPEs. There are these specific masks that are used at the time of being in the operating room. And similarly, we have space that's separated for those patients who are COVID from those patients who do not have COVID.
I like calling my patients, and I like, being able to talk to them as often as I can. If someone's really worried about something, I have them come in. If they think there's a new mass or there's something that's wrong, there's something that you think is new and different. Again, the offices are open, the ability to do biopsies are there, the ability to sort things out, the ability to get scans, it's still there. There have been many, many studies that have shown that less treatment is safe. And in fact, more is not always better. more is just more. And sometimes more can be worse. It really helps us really think hard about who needs what. What do we absolutely have to do? What's the safest possible thing? That I think is important. But I think it's also important not to stop giving people options.